Hello guys, welcome to Isham Health Tips. Today we'll be talking about meningitis, which is also a very serious problem. We're going to be focusing on some of the signs and symptoms of meningitis so as to help you, parents, brothers, sisters at home to identify your children or your brothers that have the disease, and so that you can take better measures. Okay, so what exactly is meningitis? Meningitis is an inflammation. It's like inflammation or swelling of the membrane surrounding the brain. That membrane is called a meninges. So meningitis is like the inflammation of that membrane. It is usually caused by infection, which usually gets there through the fluid that fills that space. That's the spinal fluid that goes also around the brain. So usually you can have bacterial infection, viral infection, fungal infection, parasitic infection. If it gets there, it can lead to swelling of your meninges, which causes what we call meningitis. Now let's move to the signs and symptoms. This is where it becomes very important, and I want us to pay close attention. What are some of the things you will see in a child or an adult that has meningitis? Number one, the person will show signs of confusion. We have to take note that it affects the brain. So again, you have some issues there. The swelling will cause problems. So the person will be seeming confused. The person will be sensitive to light. The person will not want light. People will be very sensitive. Show them bright light, it will be a problem. Those are key signs of meningitis. The person will have cold hands or cold feet, which is also common in cases of meningitis. There may also be a rash. There may be fever, there may be vomiting, and severe headache, which also comes with it. The person might also have some neck pain, which is also common in cases of meningitis, especially in children as well as even the adults that have it. Also, they may also show signs of joint pains, joint pains and seizures. The person will have seizures, which are all signs, very key signs to meningitis. If you notice any of these, it is better to rush the person to the nearest health facility. If you even suspect that it is meningitis, if you suspect it, you take the person to the nearest health facility. Don't even think twice. It's better to be safe than sorry. Now, those are the signs and symptoms. Now, meningitis, like I said, can be viral, it can be bacterial, it can be parasitic, meaning caused by a parasite. It can be fungal, meaning caused by fungi. The most common is viral meningitis, but the most dangerous is bacterial meningitis. That's meningitis caused by bacteria. So when you have meningitis that is caused by bacteria, that is more severe. That's the reason why we say when you notice any signs of meningitis, you get yourself checked out so that it can be verified if it is caused by a virus or a bacteria, because bacterial meningitis are very severe and it needs immediate medical attention. Now we'll talk about some of the complications for meningitis. Somebody that has meningitis will have complications such as person will have problem walking, a person will have hearing problems with even vision, a person will have seizures. That means the person will be having a lot of seizures, a lot of seizures. The person will have kidney failure. Kidney failure might even set in, and also as far as death, the person may die. So this is why we say this is very important, that if you have somebody who you notice that has this particular condition, you get the person to the nearest health facility to get them checked out for it. Now, finally, I have to also point out, children, if you are a mother, you have a child, you just give birth to a child, you're newborn, make sure that you go through the complete vaccination process. All the possible vaccines that are needed, make sure that you give your child all of those vaccines, because those vaccines are key to reducing the child's risk of having meningitis. It is a dangerous condition, please. It is very dangerous. So vaccination calendar should be followed critically. Children that usually fall victim to this disease are children that their vaccinations were skipped. They skipped some. So we should make sure that the vaccines, you should take them, and it will really help in preventing this. Some of the surface risk factors that I can give, things that can increase their chances of having meningitis also is immune system. If your immune system is not strong, if you have a weakened, suppressed immune system due to diseases such as HIV, then you are more at risk of having meningitis, because if you have HIV/AIDS, your immune system is not strong enough to fight infection. So any sort of infection can lead you to diseases such as meningitis. And also age. Meningitis is most common amongst children 0 to 5. So if you have a child at that age group, the child is mostly higher risk of meningitis, especially if the child did not take the complete vaccinations when they were born. It's a problem, and so we have to pay close attention to that. So that's what I have for you today with respect to meningitis. So I hope it was helpful. Pay close attention to the signs and symptoms. If you notice any of them, please don't think twice. Rush that person to the nearest health facility so that that person could be checked out. That is very important. Stay safe, stay healthy. My name is Ewoke Shamoni, and I'm signing out.